I'm Dr. Paul Smith from Bangor OBGYN, and I am here today to talk to you about abnormal pap tests. A lot of women have anxiety about abnormal pap tests, and I want to educate you about what it means when your test comes back other than normal. Many women feel bad. They say, oh my gosh, I flunked my pap test. But that really is not the case. Your pap test has done exactly what it is designed to do. You don't have cancer. We will never let you get there. So let me tell you about the different stages that we could see on pap tests, and hopefully I can give you some reassurance in that regard. If we cut you in half down the middle with a bandsaw, this is what your cervix will look like. We have the outside of the cervix. We have the glandular cells that lead up to where your menstrual flow comes out. There are glandular cells here that change into flat squamous cells at a point called the transformation zone. And there's a normal process that occurs called squamous metaplasia. Now, meta means change, metamorphosis, caterpillars to butterflies. So metamorphosis, metaplasia is normal. When metaplasia becomes abnormal, that becomes dysplasia. And that comes in mild, moderate, and severe varieties. And then you have what is called carcinoma in situ, and then you got the bad stuff. Now, as long as we find where you are before here, from here up, we can make this better, and we never go there. And that's the purpose of the whole pap testing program. Now, there are some other terms that are involved. Atypical squamous cells of undetermined significance. The cells look funny, but they don't look like dysplasia. And so sometimes we look and the undetermined significance is no significance. And sometimes the undetermined significance is it's something more severe. These two items are lumped into low-grade squamous intraepithelial lesion, or low-grade disease. And these guys are high-grade. And so sometimes that boundary is separated from low-grade to high-grade. A lot of terms here, sorry, but these are the terms that we use to talk about what's going on. When a pap test returns abnormal, sometimes it is low enough grade that we can just say, okay, let's repeat it in 3 months, 4 months, 6 months, and see what we really got. Sometimes we say, wow, I want to know what's going on, so I'm going to invite you in for colposcopy. And the root word is scope, and colposcopy means look at your cervix with a magnifying telescope. Let's look for visual clues to tell us, look at this boundary between the glandular cells and the squamous cells. Can we see visual clues that tell us why the pap test is abnormal? So we gather information, and sometimes with lower grade diseases, we can wait and let the body reverse the changes and get back to normal, because that's what bodies do. Sometimes there are risk behaviors, and a woman can help us help her get better. For example, smoking. The cervix contains mucus, and everybody knows about the mucus plug. Well, even when you're not pregnant, there's mucus. And so the mucus sits in the cervix. When a woman smokes, the nicotine and tar gets in the bloodstream, and it goes past the mucus, and the mucus absorbs the nicotine and tar from the bloodstream, and then it sits and it kind of marinates the cervix. And it tends to push toward abnormal. So stopping smoking can be an example of what women can do to help improve the pap test situation. If there is treatment required, then there are several procedures that can help make these cells go away. High-grade cells are sometimes less likely to get better on their own, so sometimes a procedure is required to take those cells away. Cryotherapy, freezing the cervix, was popular, very prevalent a number of years ago. That involves freezing the cells and kind of causing frostbite and letting the abnormal cells slough away and healthy cells grow back. There is a procedure called LEAP. That stands for Loop Electrosurgical Excision Procedure. There's a piece of plastic T with a wire on it, so we can anesthetize the cervix and run electricity through the wire, and we can scoop the cells off. And abnormal cells let healthy cells grow back. That can sometimes be done in the office. Sometimes it's uncomfortable. There's also a cone biopsy. That is a procedure done in the operating room when you are comfortably asleep, when the cervix will be anesthetized with Novocaine, and then the surgeon will make an incision and cut away the abnormal cells, send them to be checked on the microscope, and let healthy cells grow back. Several options to help a woman get her cervix from abnormal pap tests back to a normal, healthy, once a year, come in for your pap test baseline. All of these conditions are part of the continuum from normal to bad stuff. As long as we keep you away from bad stuff, this is all fixable. So don't be afraid of your pap test. Don't think that you have flunked your pap test. Your pap test is doing what it is designed to do. We will never let you get there. And we have several means to keep you healthy. I hope this has been useful information for you. Obviously, please discuss this with your health provider when you come in for your yearly test or for your colposcopy. And as always, if Bangor OBGYN can be of service to you, we're happy to see you here in our offices. Thanks for listening.